Hello guys and welcome back to my channel. My name is Dev Viral Shah, but you can call me Viu. Today I will be presenting about our amazing urinary system, keeping our bladder and kidneys happy and healthy, as you can see in the picture. Today I will be talking about our urinary tract, how our urinary tract works, introduction of the bladder, how our bladder stays happy, infections of bladders and kidneys, treatments for those infections, kidney stones, symptoms, diagnosis, and treatment options for kidney stones. Are you ready to get started with me? Let's go. First, I'll be talking about our urinary tract system. Our urinary tract is made up of several organs that work together to allow us to urinate or pee. As you can see here by my laser pointer, our kidneys are two bean-like organs located on the sides of our abdomen. Their job is to filter blood and make urinal. After the urine is made, urine enters our uterus, which are two little tubes that connect to each kidney. Now I'll be talking about our peristalsis process, which works by our uterus rhythmically contracting and relaxing. This process is called peristalsis, which helps us move our urine down to our uterus. As you can see, all these tiny little balls are made to relax and contract the urine when it goes down to the urinary bladder, which is our next step. From our uterus, urine enters our bladder, which is in a balloon-shaped like organ in our lower abdomen. Its job is to store and release urine. Our bladder works like an elastic balloon. It can stretch as it fills up with urine. Next, I'll be talking about urinary bladder and signals to brain. Our bladder has an inner watertight layer called the urothelium, which is an which has an outer smooth muscle layer called the detrus muscle. We urinate by contracting our detrus muscle right here. As you can see, it is tiny little strings that contrast and relax our urine like our peristalsis process, which squeezes out urine from our bladder into the urethra, which is this cylinder-like object. When our bladder gets full, as you can see on the right picture, it sends a signal to our brain, letting us know it's time to urinate. If we get distracted and avoid the signal of the bladder, then our bladder can get really full. It's important to urinate every few hours to keep our bladder healthy. Next, I'll be presenting about a mad versus happy bladder. As you can see in the left image, if you drink too much carbonated drinks, like soda, it can irritate our bladder, making us urine often. Your bladder can feel fizzy and mad. Too much soda makes the bladder sad. Also, too much carbonated drinks like soda or not orange juice, but any type of sugary drink will affect your bladder harmly. And by harmly, I mean the harmful list. As you can see in the right picture, more water equals happy bladder. Remember, urinate every few hours when you drink water. It's good for your system. Water wins. Happy bladder, happy kid, regular pee breaks are good for you. Next, I'll be talking about urinary tract infections. In some people, germs from the outside can enter the urinary tract, causing a urinary tract infection, also known as a UTI. A bladder infection, known as crystallis, can cause diarrhea, also known as a painful urination, and hematula, which is blood in your urine, as you can see in the picture here. A kidney infection, also known as pilon Paresthesis can cause fever, chills, and pain in the lower back or sides, as you can see in the picture. It can also cause nausea or vomiting. As you can see here, this next slide talks about treatment of urinary tract infection. Fortunately, UTIs, also known as urinary tract infections, can be treated with antibiotics, which can be given as a pill or through an intravenous line in our arm. Some antibiotics are oral antibiotics or IV antibiotics. Oral antibiotics are pills that you take in your mouth with water. These can help clear out germs in your urinary tract and system. IV antibiotics give antibiotics by the arm, which goes through your test tubes into the kidney and it automatically filters with the blood. Now I'll be talking about kidney stones. Sometimes minerals and salt can form little tiny stones in our kidneys. These are called kidney stones. Some types of kidney stones, as you can see on the left picture, are iridescent stones, crystalline stones, calcium stones, and struvite stones. The most common stones out of all four types are the calcium stones. Some side effects that kidney stones can bring to your body is pain, severe back or side pain, nausea, which is one type of tummy ache, and it will be really hard to pee, as you can see in the left side picture. Now, some diagnosis of kidney stones. Urologists can diagnose kidney stones by looking at pictures of the inside of our abdomen using a CT scan like the fourth image. A kidney stone will show up as a bright white area on the CT scan. Can you find a kidney stone in the CT scan in the image? Did you find it? Yeah, you're right. These black little pebble like rocks are called kidney stones. Other ways that urologists can find kidney stones is a physical exam, a urinal test, a blood test, and the most common type, a CT scan. If a kidney stone travels to the uterus, it could block the flow of urine, causing swelling in the kidney. This is called hydrosynthesis. Now we'll be talking about some treatments of kidney stones. Urologists can use sound waves to blast certain stones into smaller pieces. This is called shock wave lithoscopy, which you can see in the first image here, and a short version for that big sentence is also known as SWL. Urologists can also remove stones by inserting a small camera through the urethra and into the uterus. This is called uroscopy in the second image. This treatment breaks the kidney stones with a laser and grabs the stones in a basket. The last and final treatment that urologists use are called peritoneal nephrotomy, also known as PCNL. Urologists might need to remove very large stones through a small insect in the back of your body. This is called pericardial nephrotomy, also known as PCNL, as you can see in the third image. If doctors have the tricks, stones will be gone. Yahoo, guys! We made it to the end. Remember, always drink water to take care of your kidneys. Water is the best option. It helps prevent most types of kidney stones and other kidney infections or problems. Remember, healthy kidneys means healthy life. Goodbye, guys. The end. References and disclaimers. Source. This presentation was created by a book called Urology for Kids by Betty Nugan, Brandon Farm, which has MD and Ronald Pelogivny, which also has an MD. Tools used. All illustrations were created using Google Gemini. Disclaimer: this presentation is for informational purposes only and is not a substance to use for professional medical advice. Thank you for watching my presentation, guys. Make sure to like and subscribe to our channel. This is the first healthcare video that we're doing, and please leave your questions and opinions in the comments. Let me know if you have any other healthcare video suggestions. Thank you, guys. Bye.